Good evening. My name is Dionela Valderrama, and I'm a student at Kaiser University, and I'm getting my master's in psychology. I'm going to talk today about the slum and the dementia. The slums is a test that is given to patients that has probably signs of dementia. The slum is the St. Louis University mental status exam. It's a screening tool used to identify early signs of cognitive impairment and dementia. It's also used to monitor changes in cognition over time. The purpose of the test is to identify people who may need further evaluation, help clinicians gauge early changes in cognitive levels, indicate when physicians should pursue further testing for the patients and help diagnose the dementia, provide patient access to resources they need in the future. So that way they know, the clinicians will know what the patient need in the future. The SLUM is a 30-point, 11 items in the test. Clinician or assistants can do the test in different ways. Patients that are testing for this, corresponding to the test is more to get attention, numeric calculation, immediate and delayed recall. They had a part where they had to name animals, ditches span, they had the clock drawing, and also has a little story with the patient have to pay attention, and then you will ask them questions about the story, and they had to answer those questions. Um, the the score in the slum is the score is primarily used like the lower score. That means the patient has some type of cognitive impairment or the patient has dementia. The test co- proceed probably like takes maybe between 7 to 8 minutes to give the test. Some patients sometimes might take a little longer because you have to be talking to them, working with them, and kind of guide them through the test. The slum is primarily given to people who are suspected to have dementia or Alzheimer's disease, and it commonly is used among population at risk of cognition impairment, such older adults, and sometimes we go from maybe age 60 to 85 or a little older. Um, what it the access on the test, it goes from orientation in a space and time, short-term memory, basic knowledge and understanding of the world, attention, executive functions, and language. We're going to talk about reliability and validity of the test. Uh, to evaluate the validity of cognitive functions of the slum, both the SLUM and the MMSE can be used for clinicians to identify dementia. Both tests are very good, and the validity of these two tests, I think they, in some of the studies, they said that the SLUM is the best test for diagnose or screen for dementia. And some of the reliability of the test is the uh, it's used probably more in veterans clinics because it shows the positivity of the slum scoring lower for these individuals that has been going to war or has some other problems, mental problems, and is predicted to death and nursing home placement. Most of the time, that's what they most of them end is on nursing homes, and most of them are, having problems mentally. These results, accordance with current literature, that dementia defined by MMSE Score decreased survival in older adults, but also adds the novel finding of predicting such outcomes through new screening instruments of the SLUM. Some of the critical view and limitations of the test, most of the time, is depending on who you're giving the test or who is giving the test. Account results as a functional impairment could be the gender, the depression, the smoking, or alcohol abuse. Other limitation is to due to the routine electronic health records that data also need to be considered here. Sometimes malfunction or electronic devices not working correctly. Another tool is the analysis in large data sets. It relies on the accuracy and completeness of the clinical information provided. Potentially here is clinician depending on their report, the report and the relevant clinical features. Also, the lack of reverse human resources was identified as a problem causing disruptions on the delivery of healthcare to the people in urban slums. Some other limitation could be is the culture, the different type of patients that we have in our community. Some of them are coming, they don't speak the language, so we had to give in to them in their own language so they can understand the test. Sometimes we had to have a translator to help us to administer the test. We have also ethical concerns and application of the assessment. Neurocognitive assessments of patients with memory problems is determining their cognitive state, but is time consuming for clinicians evaluating those patients. Cognitive view could be beneficial in detecting early stage of multi-domain um, or the cognitive impairment in patients. Some of them have sleep disorders. Some of them uh, interventions, strategies, and follow-up over time to improve patients' outcomes. Some of the semantic dementia requires differentiation from other neurodegenerative conditions, such as the FTD and Alzheimer's disease. The introduction of disease-modifying therapies for Alzheimer's sometimes require major changes in dementia care or clinical practice. Every clinic is different, so the patients in these locations, they have to adjust some of the tests and some of the treatment that they are supposed to be given to them, and some of them requires more attention, so they might have to see a neurologist or see a psychiatrist sometimes. The early recognition of cognitive impairment is imperative, as cognitive changes are often associated with behavioral changes. When the patient start getting a little more deeper into dementia or getting more problems, we can see the different types of behavior these patients start showing to us and to the family. So we had to pay very good attention and make sure that this individual has the resources and the help they need for their disease. The methodology of the assessment, the SLUM and the MMSC instrument described as a very good test for the patient. The SLUM exam scoring MCI, which is mild cognitive impairment, depends more on education. When you administer the SLUM, we have to ask the patient how high the patient is having their education, if it's just been going to elementary or only finish junior high or finish high school or has some type of college degree. So we go by education. For less than high school education's normal score is probably at 25 to 30. Uh, the slow MCI score is 20 to 24. And the slum that can decide it if the patient has dementia is when the score very low, like between a 1 to the 19. Most of the time, patients think that because they forget things, they are already having problems with dementia. No, most of the time, we give the test just to measure, but most of the time it's because the mind processes so much mm, uh, uh, information. The most of the time it's not because we have dementia, it's just because we have so much stress during the day, and we have so much in our mind that we forget about things, like for example, you forgot where you put your key. So that would be a good example that you're not getting dementia because you forget where you put your key. It's just through the day, the individual um, go through so many levels in their life or during the day, and thinking about some other stuff, having so many problems or problems at work, problems at home. So all those things kind of make you forget things. But most of the time, the low score is between 1 to 19, and dementia score is 1 to 20. Patients with dementia requires a very special um, care, and also a very close um, uh, to treat the patient. Most of the times, these patients, if they are very old in age, most of the time they need to have somebody with them most of the time. If you are a little younger but you just having some mental issues, most of the time the provider will put you some maybe a medication so we can alleviate that. Sometimes some treatments, some maybe to see a psychiatrist so they be able to talk to you and to be able to help you a little better and prescribe the right medication too. Over time, sometimes the language cannot get affected. Sometimes we don't recognize people, we don't recognize the voice, we don't feel that we know the person. Um, is very limited. Um, Patients roughly they go through so much through their times when they have dementia or Alzheimer's, and it's very sad. It is a very sad disease. I can put a sample. My mom, she passed away last year, 99 years old, and my mom was having a little bit of dementia. I remember 5 years ago, I went to visit her, and the hardest part of my life was for her not to recognize me. Um, of course, it's 5 years been passed. She don't see me every day, and of course, her mental capacity was deteriorating a little bit, and she didn't recognize me. And for me, that was one of the hardest part in my life because I am always being very close to my mother. Um, my mother kind of little by little she developed dementia, but then probably I would say maybe 30, maybe 25, 30 minutes later, she recognized me, and that will make me feel a little better. But we have to go through all that to understand about dementia, about Alzheimer's. That is a very sad disease, and for me, I would love to research more about it because I feel like I can help some individuals to cope with the disease, or families to cope with the disease, And I think that most of the time when you are prepared, you be able to take a family member, you be able to take care better, and you be able not to feel in shock because the person don't recognize you, knowing that it's your mom, knowing that you are the daughter, and they don't recognize you. So I think that it needs a lot of further research, and I would love to one maybe one day try to do that. The conclusion of my PowerPoint today is that it's a disease that is eating up everyone. There is so much, so many different type of people that face dementia different, and that's why a lot of the clinicians need to get a little more experience and have the time to talk to the patients. Patient experience their symptoms and can be heavily modulated, and especially the different type of cultures that we had in our country, and the different type of religion belief. So most of the time, people don't pay attention to that, but it's very important to balance both because you can easily insult somebody without knowing that this person cannot be able to be living like that. It's also very difficult for families to be able to cope with this, and I think that a lot of training and a lot of we need a lot of resources out there for families to be able to cope with their families that have dementia or Alzheimer's, and uh, to find the key to be able to for these people to have the best healthcare and provide the best service that we can give to them. Um, Cognitive screening are very important, and I would say that I'll advise that this will do more more often to patients that are 65 and up, because sometimes, believe it or not, you can early diagnose dementia or a little bit of Alzheimer's, and maybe the providers be able to help this person to control a little bit the disease. Hopefully, one day we'll be able to cure this disease because it's a very, like I said before, it's a very sad disease, and it's a very strong and very disrupted disease for families and for the patients. Most of the time, patients don't understand too much what's going on because, of course, the mental capacity is not there, but the the family are the one that needs to be able to cope with that. And I think that we need to get resources where families be able to take care of their parents or their children. Is I don't think it's being located on children's, but most of the time, if they got some kind of brain injury, I think these resources can help people to manage their daily activities and maybe to feel a little more closer and a little more relief of the care that they are giving to their family members. Future research may intend to compare the SLUM with alternative cognitive screens that have better psychometrics than the MMSE and have been known in older adult population. So, in other words, we need to research more on this test. I know that right now they are accepting the SLUM as one of the best tests for screening dementia, and the MMSE is another one that it helped to uh, screen the patients. Um, and not to say more, dementia. is a very sad disease, and we as future psychologists, I think that we need more research and we need to build more skills as far as taking care our family members or patients. Thank you, and you have a nice evening.